Nearly 8,000 people have signed a petition calling on Health Minister Phaahla to compel medical professionals to disclose minor pregnancies.
Over 90,000 births were reported between or among girls and young women between the ages of 10 and 19. This was for the period 2021 to 2022. But child rights activists are concerned that this may deter young women from accessing medical facilities.
Kekeletso Kena, who started the petition, says children rely on adults to disclose when they've been violated.
People are going on and making hypothetical assumptions about how children don't want people to know. Why is a 10-year-old wanting to hide the fact that Ubaba Mkhize has made her pregnant? Why is a 10-year-old being pregnant? Those are the questions we should be asking, and not trying to block something that is going to ensure that we can protect these children, even within communities, because if the child is taken away from the formal healthcare sector and is taken to a traditional healer, a doula somewhere, when you know in your township that there is a 13-year-old that is pregnant and suddenly they're carrying a child, you know they gave birth. They must now tell you, you must then find out where did their child give birth. That person that helped that child give birth must then be held accountable. This is what we are asking for. Everybody must be held accountable if you do not report that a child has been pregnant, because we really do want to know what happened to the child.
For more on this, let's speak to Lisa Vetten, who's been an activist in the gender space for years in South Africa. Lisa, very good evening to you. Welcome to News at Prime. So, would putting this obligation on healthcare facilities to report cases or instances, as Nicholas was saying, where girls or children basically are impregnated, report that to the authorities, would that work? Would that help to deal with the problem?
To be honest, it is actually already the law. In terms of Section 115 in the Children's Act of 2007, as well as Section 54 of the Sexual Offences and Related Amendments Act, it's already a duty on healthcare practitioners to report. So I think while it's clear that there's a real intention and a concern with doing something about teenage pregnancy, and here I'm talking specifically about girls under 15, the law is already stating that there is this duty, and it's not only on healthcare practitioners, it's on teachers. You know, in the case of the Sexual Offences Act, it's sometimes also on neighbours as well, anybody who actually knows that a sexual offence has been committed against a child. So it is in place. I think the broader question we need to ask is, why do people not know that this is the law?
And I would imagine, for example, someone who works in a place such as a hospital, a clinic, or even in the case of teachers where there's a similar obligation, they should be informed or even trained on this obligation. If so, why aren't we seeing more of this being reported?
That's a really good question, and I think that's the question we should be focusing on, is what is wrong with our systems. Now, on the one hand, it is correct that people don't always know what their duties are, but the second is that people are not reporting. And even though it's a criminal offence to not report, they're not necessarily being prosecuted either for not reporting. So I think we need to go and inquire into what is going wrong with the systems. And from the little bit that we've been able to unravel so far, there seems to be a great deal wrong. So I mean, just to be clear for your viewers, people have the option of either reporting to the police or going to a social worker. So if you go to the police, you obviously lay a formal criminal charge. If you go to a social worker, then you might be dealing with the matter slightly differently. And that might be a situation where somebody may not want to report, but it's very clear that you can't ignore this. There needs to be some kind of intervention. So you might then want to rather go to a social worker, especially if you're reporting a matter that might have happened 2 or 3 years ago, for example. So there are those two options that are available. Part of, I think, the reason is that, as I said, is that systems break down. Forms don't get filled out in the way they should. Investigations aren't followed through. And so we have a system that doesn't work the way it is. And I think you also have a problem where a lot of people don't have faith in the system. And that's another reason why they choose to not report, because they feel actually if they're going to report, they're going to expose the child to more harm. So there's a real need to focus on fixing our systems.
How do we change that? Because when we talk about especially violence against women and children in this country, that comes up a lot, right? Where people say they know they've been violated, they want justice, but simply don't believe that reporting the matter to a police station, a police officer, or even getting as far as court will bring them any sort of recourse.
Well, the pessimistic answer to that is, on one level, they're right. The conviction rate for rape in South Africa is less than 10%. So 9 out of 10 rapes will never result in a conviction. So we have to do very much better in terms of the quality of police investigation, the quality of the medico-legal examination, and the quality of prosecution. But even so, I think it's going to be very hard to always have a 100% conviction rate. And so it's important to think about how else do we help people, especially if they don't want to report. Can we offer them good supportive counseling, for instance? Can we get their families involved in trying to understand what happened here? How can they be more supportive to the young person in their family? How do we bring in the other party? How do we get them involved? You can use, as has happened in other parts of the world, systems called restorative justice, which is very effective, I think, with younger people, and especially with younger men who don't want to get into the criminal justice system. You don't really want to put them into prison. And you're using a diversion system where you put them through programs that look at how do you take responsibility? How do you change your conduct? Why did you behave the way you did? Are there better and different ways in which you could behave? And unfortunately, those aren't sufficiently well studied or funded enough in South Africa. I mean, in Gauteng, for instance, there is only one program funded to deal with child sex offenders to ensure that they are able to change their behavior. So it talks to the need for us to shift our focus and put it into creating very much better services for young people to go to.
How important in this conversation, Lisa, is it to also delve into who is impregnating teenagers in this country? Because, yes, we know there's a great deal of older men who take advantage of children, basically. So there's the argument around statutory rape, but also peers who may be in relationship or are themselves minors who attack others. Is there a clear idea of who's mainly responsible for this crisis?
Probably not, and I think that's a very good question to be asking because it means different things. Can I just quickly explain the law around age categories?
Yes, please.
Okay. Any girl or boy under the age of 11, the law says cannot consent, and you must always treat that as rape. And the same with any child who's accused of rape if they're under that age. They're thought to lack the mental capacity. However, between the ages of 12 to 15, the law says you can consent, but you're not allowed to consent. And it says where you have children where there's no more than a 2-year age gap between them, having sex together, you don't charge them with statutory rape at all. You put them through a diversion program. However, if there's an allegation of rape, you obviously go ahead and charge with rape. But where it's consensual and the two children are more or less similar in age, then you don't go ahead and charge. So you obviously want a very different kind of intervention where you're dealing with young people who are experimenting between the ages of 12 and 15. Clearly, you prefer them to delay sex, because of all the consequences of that. The concern, I think, is when you get typically older boys and men who are over the age of 16, specifically going after younger women because they are manipulable. And then they could end up with a statutory rape charge, depending on their defense, or it could be active rape. And so the kinds of programs you would want to target at those age groups would be different to those in peer groups. You'd also want to be able to work with young people around how do you resist peer pressure? How do you manage to do, because I think there's a lack of recognition of how even when you're 14 or 15 years old, you can already be in an abusive relationship. And so I think it's important to start equipping young people with how do you say no without your friends laughing without you worrying that your friends are going to laugh at you or that there's going to be something strange and peculiar about you? What do you do when your boyfriend keeps on pressurizing you for sex and you're only 14 but you don't really know how to say no and you're worried what will happen if you do say no? So we also need to educate around relationship skills at schools. So there's a lot of different things that we need to do outside of simply opting for the criminal justice system.
Right. And what you're saying, Lisa, also speaks to, am I right, the veil of secrecy often that comes with cases where a teenager or someone younger has been impregnated. In fact, let's park the younger children for a moment, but in teenagers or among teenagers where they've been experimenting, often there's a sense of guilt, whether the pregnancy comes from consensual sex or, in fact, an assault by someone that they knew. They are quiet or don't feel comfortable telling because they feel as though they participated actively or encouraged what has led now to the consequence of a pregnancy.
Absolutely. So I think there are a couple of things that we would be wanting to tackle. The first, I think, is stigma. And I think so many of our conversations about young women's pregnancies are often very, very stigmatizing. So even if we're trying to say, yes, you've been violated, we nonetheless make it sound like something terrible, terrible, terrible has happened because you are a young person who is pregnant and about to have a baby. We need to remove that stigma. Obviously, I'm not saying we should say it's a good thing, but we should not stigmatize the mother or the child. We should look at how do we support you now that this has happened. And we don't make it so that you don't feel ashamed of yourself and as if everybody's looking at you and judging you because you're having a baby. So I think shifting the conversation away from stigma is a very important first start, because then I think it enables young people to come forward and say, this is what has happened. The second thing, and I think relates to things like having youth-friendly or adolescent-friendly health facilities. Many young people don't go to clinics and don't go to hospitals because of the way that the health workers treat them. They are often very judgmental and often say very stigmatizing things. And actually, you would much rather a young person goes and gets contraceptives and doesn't do that because they're worried about how the health worker will respond, or that the health worker is going to go and tell their parents what's happening. So then we also need to look at what kind of facilities do we have and are they adolescent friendly. So if we look at those kinds of options around, firstly, creating an environment where parents or adults can talk to adolescents about sex, because if they don't talk to them, they're going to go and find the information off the internet, and porn sites, which is hardly a good education, I think, in respectful sexuality and how to deal with difficult situations. So I think if we looked at a whole range of different kinds of options and also looked at how do you make good health care available, how do you have sensitive health workers who are supportive and understanding to young people, how do you make sure that clinics even have contraceptives? It would be another important part of the conversation. How do we talk to young men as well about respecting boundaries, about waiting, about the pressure they sometimes feel to be sexually active because then they'll not be considered proper men if they're not sexually active soon and young. So I think a range of different kinds of approaches that target parents, that target schools, that target health facilities, target young people themselves and their peers would help us come at this problem in a much more holistic way.
Lisa Vetten, activist. Good to speak to you as always, Lisa. Thank you for your time.